Healthcare expenditures will rise above average for employers in 2023, in part due to the unmet demand for medical services. The Business Group on Health recently published trends to watch in 2023 to assist employers in trying to understand how the healthcare sector will look in the upcoming year. Each trend, according to Ellen Kelsey, CEO of Business Group on Health, relates to employer health and well-being goals, but they also exist against the backdrop of the global economy, labor trends, innovation, and the policy and regulatory environment. As a result, both businesses and employees will be impacted by issues in the coming year, from a lack of providers to rising healthcare costs. Here are some of the report's highlights. Affordability of healthcare is a primary concern for both employees and companies as expenses climb. Healthcare expenditures will rise above average for employers in 2023, in part due to the unmet demand for medical services. The Business Group's 2023 Large Companies Healthcare Strategy and Plan Design Survey found that 43% of employers have already noticed an increase in medical services as a result of care being delayed during the pandemic, and that another 39% expect to see a similar trend in the future. As more late-stage tumors are discovered and more expensive treatments become available, cancer is also currently the ailment driving healthcare trends and expenditures. These cost challenges are not being transferred to employees in the form of higher premiums and out-of-pocket expenses in order to address affordability. Employee cost sharing remained mostly unchanged in 2022 as a result of employers absorbing the majority of these increases. However, the capacity of employer plans to handle rising healthcare expenditures may soon be limited as the economy remains erratic. Offerings for health and well-being will be affected by changing workforce dynamics. Employers are becoming more aware of the benefits that health and well-being may have on their overall workforce strategy. 65% now see it as playing a crucial role, up from 27% only 5 years ago. Therefore, as part of their long-term strategy, firms will continue to invest in health and well-being offerings. However, difficult circumstances are having an influence on affordability, which is probably causing efforts to be reprioritized, new alliances to be formed, and employee collaboration to assure relevant and high-quality services. Employers will deal with health disparities in a variety of ways. Employers have always prioritized addressing the needs of underserved and marginalized communities within their workforces, and they will continue to do so through their health and well-being initiatives, with a focus on childcare, money, and the social determinants of health, SDOH. Expanding coverage and benefits for neurodiverse populations and transgender people in their workforces is another way companies are addressing health justice. Additionally, there is growing support for diversity, equity, and inclusion, DEI, initiatives that prioritize disability inclusion. Employers intend to give special attention to women's health in relation to reproductive care in the following ways: extending fertility benefits to all types of families, reducing maternal mortality in underserved communities, and boosting coverage for doula services for expectant parents. It will be even more important to have initiatives that help individuals during difficult times. Employers and employees place a high importance on mental health since it is thought to be intricately linked to other aspects of well-being, such as physical, financial, and social health, as well as job satisfaction. 94% of employers have a financial component as part of their overall well-being plan in recognition of the rising financial demands. While retirement savings still play a significant role in financial security, many businesses now provide tools and resources to help with issues including emergency savings, debt repayment, household budgeting, early access to earned income, and paying for college. This comprehensive picture of employees' financial lives is predicated on the knowledge that stress related to money has an impact on employees' productivity and performance, as well as their physical and mental health. Value has returned to the fundamentals. Employers and others are keen to transition to value-based payment models, which link provider reimbursements to improved patient experience, cost mitigation, and better outcomes. This is because of issues like rising healthcare prices, unsatisfactory patient experiences, and substandard outcomes. Such payment methods are required for both in-person and virtual care environments and include advanced primary care, high-performance networks, accountable care organizations, and centers of excellence. Providers are more likely to use team-based care when keeping patients healthy, rather than paying for services, is the major driver of financial success. Evidence also suggests that when healthcare professionals are driven to offer better treatment for all patients, their performance on quality metrics can rise while discrepancies in outcomes are being reduced. The field of virtual health is at a turning point. Virtual health has been gaining popularity as an alternative to in-person care prior to the pandemic. This includes telehealth for primary and urgent care, teletherapy, chronic condition management, navigation services, and others. However, nowadays, virtual health is seen as a supplement to in-person care. In spite of worries that these services contribute to a fragmented and complex system, 55% of businesses will increase their virtual health offerings, according to the Business Group's 2023 Large Employers Healthcare Strategy and Plan Design Survey. As employers, vendors, and consultants work together to improve virtual health products and outcomes in 2023, virtual health may experience a change. Access to healthcare will be impacted by policy and legislation. The upcoming year in the United States is expected to bring considerable ambiguity over state versus federal regulations and limitations on employer-sponsored programs. Employers will also need to negotiate judicial reviews of long-standing precedents like ERISA preemption and Affordable Care Act preventive services. The value and durability of workplace health and well-being programs, as well as continued employer participation, will benefit working families across the country. The business group also expects that major corporations will look for opportunities to collaborate with legislators on matters like expanding access to and lowering the cost of care for women's health, mental health, and other medical requirements, as well as modernizing the delivery system through payment model reform and transparency.